Now we would like to proceed with Lumenis, one of the leading companies in Israel in ophthalmology, not only in ophthalmology. And I would like to invite Itai Meyer, VP Managing Director Vision at Lumenis. Itai, welcome to the stage.
Thank you, Nahum. Thank you, everyone. Great to be here. I believe it's for us, it's the second year in a row. So, for those of you who aren't familiar with Lumenis, I think Lumenis is kind of the oldest or the legacy company in this room. Lumenis is actually 50 years old, and Lumenis actually invented the first laser ever launched in ophthalmology, again, 50 years ago. Since then, it was then named Coherent Medical, which was merged to EMC and Sharplan, et cetera, and now we are Lumenis. Over the past 50 years, we have launched different products in different segments in eye care, and now we are operating in retina, in glaucoma, and in dry eye. And we have a very strong base of R&D and clinical work that is done in Israel while we sell everywhere in the world. But I'm here not specifically to talk about Lumenis or R&D. I think, we've all seen some great presentations today about R&D and clinical. I'm here actually to say something quite surprising, that in my opinion, in our expertise in Lumenis, marketing is as important as the clinical benefit of the products that we are developing. Because if we are developing the best products in the market and they're not reaching eventually to the patients and to doctors, we are not actually doing much. And actually Lumenis, and it was actually great to see Daria here, because we have the great example of that statement. SLT was actually invented by Lumenis more than 20 years ago. And while it was always known to be very effective and very safe, it was always, for the past 20 years, it was pushed as a second-line therapy for several reasons. And the perception was that laser is more dangerous and it should be pushed to a second-line therapy versus drops. While it is not very dangerous, it's very safe, and it's actually more effective than drops. Things have changed due to the LIGHT study, new guidelines for treating open-angle and glaucoma, the work that Belkin and others are doing in this field, which is great. That said, it was too long of a journey. And knowing that, when we obtained a de novo clearance for our dry eye device called Optilight in 2021, that was actually during COVID, we knew that it's not enough to have amazing clinical results like we have with Optilight. You can see here that we are improving both signs and symptoms of dry eye using IPL for treating dry eye. We got amazing results in our clinical studies showing reduction in inflammation post-treatment with our device. We are actually even changing the morphology of the glands post-treatment with IPL for dry eye. We have designed really the best-in-class premium product for treating dry eye, really cutting-edge technology that was built over years and years of R&D and clinical work that we have taken from our aesthetic branch in Lumenis and brought it into ophthalmology. We knew, based on our experience, that nothing matters, and it's our time to shine. And in order to do that, we need to elevate our marketing work and brand development and commercial excellence to the same level as the product and as the clinical work that we are doing. So I'm going to share with you a bit about our journey of taking Optilight from the clinical work and the R&D phases to full commercialization, share with you some of the things that we have done in terms of marketing and eventually why it has been so successful. and some thoughts. So for us, once we got the approval in 2021, we started very hard with developing a strong brand, okay? Which is, again, now we call it OptiLite. Back in the day, it was just OPT or IPL. And we thought about putting the customer first, the patient, and as well as physicians. While, we are relatively a large company in Israeli terms, once we went to the dry eye market in the US, we competed against the Xiidras of the world and Shire and J&J and Alcon, etc. Nevertheless, we actually went all in and decided to focus both in our marketing on patients and physicians. And actually, we made a significant investment in terms of marketing. Susan mentioned earlier talking to patients and talking kind of to the end customers, and actually this is what we did. So actually, even when we obtained the clinical, the FDA approval in 2021, we didn't launch it immediately. We ran surveys, we ran focus groups, etc., in order to understand what really dry eye patients are suffering from, what's their perception of this disease, and actually, although we went to all of these, conferences and trade shows, and we talked to a lot of patients, it caught us by surprise. What we've learned is that although dry eye is very, very common, and millions of people suffer, all over the world, and specifically in the US, from dry eye, too often it is regarded as just as a nuisance, something that you have to live with it, something that has no real solution to, and something that you can, some patients are taking drops 10 times a day, and they think it is normal because it is what it is, and I just need to live with it. That really guided our approach to direct-to-consumer and to patients, because we decided to focus less on the disease itself and more on the quality of life issue, to focus less on our technology and how it is cutting edge, etc., and focus about, what you're going to gain from it, how it's going to improve your quality of life, and telling patients, hey, it's not just a nuisance. Actually, you have something real, and you don't have to live with it. All of those kind of insights from surveys, focus groups, discussions, etc., led to a very successful campaign that we ran nationally in the US, and it looked like this.
Dry eyes, and you don't even know it. You get to a point in life where you just stop putting up with certain things.
Totally.
Like dry, itchy eyes.
Or 6-inch heels.
No way.
Or laugh at unfunny jokes.
We are the not gonna live with it generation.
Optilate, the first and only light therapy for dry eyes, so you don't have to live with it.
Optilite, a bright solution for dry eyes.
So that message of not going to live with it, was perceived very, very well by patients. And we, again, as mentioned, we invested heavily, and we went with a nationwide campaign using different, influencers, and it's very different. Of course, we talked a lot here about commercializing and reaching out to doctors. It's very different when you want to simplify things and you want to get this message to consumers. And this is what we did with different influencers. We really invested heavily. I'm talking about Times Square billboards. I'm talking about, live TV shows in the US. Heavy investment in direct-to-consumer in all of social media channels available in the US. And again, this message really kind of hit very well, and it started generating demand for us bottom up, and we really saw that it is really effective. As for doctors, we wanted to do something completely different. Again, focusing less about the cutting-edge technology and focusing less about even the clinical benefit that existed as well. But we wanted to tell them, hey, for too many years, you've been treating dry eyes with different modalities, drugs, devices that just aren't effective enough. Now you have a chance to be the hero. Now you have a chance to really help your patients. And we wanted to tell doctors that's going to differentiate you as a doctor. And of course, since it's a cash-based procedure, and actually we wanted it to stay as a cash-based procedure, so we are not filing for any reimbursement, that helped us as well because it helps physicians financially. And our message there is you have an opportunity from being a doctor to becoming the doctor. And the campaign looked different from the direct-to-consumer campaign. It looked something like this. Sound?
Help people to do something that makes a difference.
Here she is, the miracle worker I've been telling you about.
Now I get to be the doctor that helps change patients' lives. With Optolight's innovative technology, I can offer my patients a real and effective solution for dry eyes.
Be the doctor who patients can count on. Optilight, a bright solution for dry eyes.
That campaign really resonated with doctors. And, you know, again, like we did with direct-to-consumer, we started actually increasing our investment in trade shows and everything that we do, you know, to doctors. And actually what was cool to see is, you know, it became viral. So Optilight became viral among ophthalmologists and actually among optometrists as well. So these are just examples that I'm not gonna play right now of cool TikTok, Facebook, Instagram Reels that doctors are generating and just posting about Optilight. So it's very cool actually to see your messaging being amplified by doctors organically without us paying anything for that. We got endorsed very, very well by, you know, dry eye doctors, again, ophthalmologists and optometrists in the US, across the US. I think vast majority of dry eye specialists right now in the US have our device and actually have our second device for dry eye, which I'm not going to speak about right now, that we've just launched. So we got very, very strong endorsement. So just as an example, if we look at optometry, 16 out of the 24 optometry school got our device, and now they are training the next generation of optometrists on our device, Optilight, for treating dry eye. They all purchased the device within a span of a year and a half. So, and we are planning actually to reach 24 out of the 24 this year. While we are, you know, a private company, I cannot share really the details and you know, our actual revenues. I would say that, you know, we are a legacy company, so actually our 2019 revenues are pretty significant, but still you can see the increase in revenues. We've, you know, now we're selling 5 times more than we did in 2019 pre-COVID, just after the launch. So this has been a great success for us. And, you know, if you have any more questions later on, want to reach out, I would be more than happy to share more about our commercialization expertise and thoughts and insights, and would love to support this great community in Israel. So thank you very much.